Pseudo-gynecomastia versus gynecomastia. Gynecomastia is a term frequently used to describe male chests that appear big, obese, or womanly. The disease known as pseudo-gynecomastia, which may appear similar to real gynecomastia but has a different underlying etiology, affects some males with breasts that resemble those in women. Finding a board-certified plastic surgeon in Sri Lanka is important. We have made it easier for you by making our plastic surgery clinic recruits only board-certified plastic surgeons. Knowing about pseudo-gynecomastia. Pseudo-gynecomastia is a disorder where there is too much fat tissue in the male breast area, namely behind, around, and around the nipples. The term, fake gynecomastia, is a very serious issue for certain men and can lead to medical and psychological issues, even though pseudo denotes false or hiding something else. How to control it? Weight loss is the first line of treatment for pseudo-gynecomastia. As you reduce body fat, your chest will also likely shrink. For weight loss and chest sculpting, the majority of men employ a mix of dietary adjustments and increased exercise. Some guys find that wearing compression shirts while dieting gives the appearance of a slimmer and flatter chest. Even when a man reaches his ideal weight, pseudo-gynecomastia may persist in certain guys. The degree of residual fatty tissue and whether or not there is a component of loose skin will determine the course of treatment. Stubborn fat deposits can be removed with liposuction alone. If there is loose skin in addition to the residual fat, a skin component also needs to be reduced to tighten the skin. Depending on how much loose skin is present will determine the incision placement. During these procedures, the areola is also made to be proportional to the new chest contour. In many patients, the areola, which is the darkly pigmented skin surrounding the nipple, can be enlarged and may be the source of embarrassment. Understanding gynecomastia. The main difference between pseudo-gynecomastia and gynecomastia is the type of tissue that causes the breasts to look enlarged and feminine. In gynecomastia cases, the male chest area has an excess glandular male breast tissue and possibly excess fat tissue, too. Compared to adipose tissue, glandular tissue is stiffer and more fibrous, and it is unresponsive to dietary or activity modifications. It is typically brought on by an imbalance in hormone levels, although there are other potential reasons, such as the use of certain pharmaceuticals such as steroids and illegal substances like marijuana. How to treat it? Male breast reduction surgery is advised as the first line of treatment for genuine gynecomastia. Liposuction is enough to remove fat tissue during the procedure in most cases. The plastic surgeon removes the glandular tissue using surgical excision procedures. To obtain the desired chest contour, extra saggy skin can be removed and the remaining skin can be tightened, if necessary. Since the operation is often done through a little incision made around the areola and the armpit area, there is generally little need to worry about visible scars after the procedure. Speak with Plastic Surgery Clinic, Kandy, Sri Lanka. Are you bothered by the way your chest looks? You are not by yourself. We will tell you whether you have gynecomastia or pseudo-gynecomastia during your consultation. We will check your chest, go through your health history, and go over your available treatment options. Contact us by phone at 07763000580 or by email at info@plasticsurgery.lk to arrange a consultation in our clinic. We also provide video consultations at your convenience. Plastic Surgery Clinic Kandy, Sri Lanka gives you the best treatment modalities in the world.